Coverage continues right now as kids in New Haven get set to head back into the classroom next month. The Elm City is looking at teaming up with Yale to keep students and staff safe from COVID-19. Channel 3 New Haven Bureau Chief Matt McFarland is live at the mobile newsroom in the Elm City with much more. Matt.
Well, Aaron, doctors and researchers at Yale School of Public Health came up with this saliva test, and the city says they know this can be a game changer for their students and their staff members when they head back to school. Basically no longer having to deal with that swab up the nose and instead just having to spit into a tube. It's pretty invasive, and some say it can be really uncomfortable. But in order to get the coronavirus under control, testing is key. And while New Haven Public Schools is offering free testing like this at its schools, once the kids and staff head back next month, there's a proposal to swap the nasal swab for some spit.
Saliva test is another avenue that we are looking to increase and expand within the school district.
New Haven Health Director Maritza Bond says the city is working with Yale School of Public Health to bring its Saliva Direct test to students and staff.
Saliva test seems to be a very popular thing because it's less invasive.
The idea is to start the testing in the city's high schools, and with cases rising in the city, Bond says they would use data to test in hotspot areas dealing with an uptick in positive cases.
There is a preference for testing and screening, and the saliva screening will allow for an easy, very efficient way for us to be able to identify from a pool of students and then just be able to focus in on those that are positive and isolate them as needed.
While tests typically run between $10 and $15 to screen all school staff for the entire year, it would cost $500,000. Add in high school students, it goes up to more than $1 million. But Yale Public Health is working with the organization Testing for America to pick up the tab for the initial 6-week program.
The cost savings is tremendous, especially the savings of lives and being able to really reduce the risk of outbreak relatively easy. We want to make sure that it's sustainable, and so we are ensuring that we have this at no cost to the school and no cost to the families.
Now, the health director says if they get that funding for the initial 6-week period, that testing will start in mid-November. She says they'll use that time to look for additional funding so they can keep the program going, hopefully for the entire school year. We're live with the mobile newsroom in New Haven. Matt McFarland, Channel 3 Eyewitness News.